Hello. So, for my project, just a little bit of background. You don't need to be a nursing or science student to have a bit of an idea of how the digestive system works. You take in some food, your gut does its thing, and then you excrete out the waste. And that's usually the end of the story, right? Well, there's a proverb that goes that one man's trash is another man's treasure. And in healthcare, we've actually tried to take this waste and get it back into the digestive system. So on the screen, I have some capsules. I know. And in these capsules, we have freeze-dried human feces meant to be ingested. They're actually called poop pills or capsules, depending on the source that you're reading. And the purpose of them is the power of these capsules we're seeing is that they are able to improve the quality of life with people suffering from recurrent bacterial infections, irritable bowel disease, and even Alzheimer's. And that was the focus of my project, fecal microbiota transplantation and how that's being used as a mental health intervention. But before we get there, you probably want me to answer the very important question, why poop pills? And it's important to consider the gastrointestinal tract. So in our large intestines, we have a large colony of microorganisms, largely bacteria of different kinds, and we have a symbiotic or mutually beneficial relationship with them. So food that our body can't digest, these bacteria help us break them down, and we excrete them as waste. And part of that process, some of the bacteria actually also come out of the body. And sometimes I like to think of it as something that rings true in our society. There is strength in diversity. But we might encounter some patients that have an imbalance in the types of bacteria. They have a lower level of good bacteria in their gut. And so that allows bad bacteria, like in a patient with recurrent Clostridium difficile infections, to experience symptoms like nausea and vomiting. Because there isn't as much diversity, the bad bacteria can proliferate and cause these types of symptoms. And so the reason we'd introduce the pill is because we would get stool donated from someone who has a healthy balance of bacteria from their gut. We'd give this affected patient a course of treatment, and we have seen many studies showing an improvement in the symptoms, specifically for C. diff infections for those people that took the course of our poop pills. Now, you might be asking, what would that have to do with mental health? And for that, I would also like to introduce you to the concept of the relationship between the brain and the gut. So we have a concept called the brain-gut microbiome axis, and that helps us understand that the brain and the gut communicate and are related. In fact, as part of the peripheral nervous system, there's a whole section called the enteric nervous system, where the nerves, all they do is innervate the gastrointestinal tract. And so your brain health and your gut health are related. It's a really fascinating relationship, and I would really encourage you to learn more about that if you're interested. But for the case of today's presentation, clinicians and researchers were starting to see an interesting relationship where patients that were coming in with an onset of major depressive disorder or maybe bipolar disorder and other neuropsychiatric disorders also had an imbalance in that bacteria. So they didn't have as diverse of a population of bacteria, and they had a lot more bad in air quotes bacteria growing there. And when they underwent a course of FMT, they actually saw an improvement in their symptoms. This is still a fairly experimental form of treatment. It's been proven in many clinical studies to be effective, but as a mental health intervention, it's still a bit new, and we sometimes have to get over that sensational nature of how do we use food help better people's quality of lives. And so it's important for us to actually take the time to do more clinical studies and more research to see, is it truly effective? Is it a placebo effect? And are there other conditions apart from major depressive disorder and bipolar disorder that FMT can actually help treat? And the story keeps on going. Apart from infections, apart from mental health disorders, they're actually experimenting to see if FMT can be useful in helping patients that are trying to lose weight ahead of bariatric surgery. And some of the conclusions are split on that, but we can see that there's a wide world out there of possible interventions that FMT disorders or diseases that FMT can actually help support. I read a paper about a study that was happening last year where they were trying to see if FMT had an impact on liver cirrhosis and improving the quality of life or the symptoms of some of the patients. And while we use terms like donor, transplant, recipient, it's important to note that FMT is not like organ donation or like tissue donation, which is highly regulated. in at least a province like Ontario. And it's important for us to take the steps to see how we can protect our donors and our recipients who are taking the risk of going with this experimental form of treatment. I hope from this presentation you got a bit of got a sense of the importance of taking care of your gut, because your health is really impacted by everything you put into your body, and we can measure health by all the things that come out of the body. And if you're interested, you could scan the QR code. There was a really cool article talking about how FMT can be used as an adjunct therapy for treating major depressive disorder. And these are the sources that I used in my poster and my presentation. Thank you for your time and your attention. Sure. I found, I think one of the skills that I learned was patience when doing my literature review. There's a lot of literature on this topic. It's not that recent. I actually found out that it's been in like the scientific community as far back as the 1950s. It's only in the recent years that we've been seeing a more sensational like articles maybe about it. And so trying to differentiate between what I might read in a news article about FMT or about what a hospital is doing or about what a new pharmaceutical company is hoping to achieve versus what researchers are showing about that effectiveness. When I talked about the FMT used for obesity and seeing if that actually improved their outcomes, I saw some people saying that it did have an impact, and then there were other papers that said it doesn't have an impact. And so filtering through those and trying to show a balanced view, and like the poster and even in this presentation, I think that was a skill that